All right, my name's Adam. I just wanted to talk with you guys a little bit about infectious diseases and caving today. Obviously, this is a pretty broad topic, so I'm going to just cover a few things, and we're going to try to keep moving along and save us some time here. But, yep, I'm a second-year medical student, and, yeah, let's get into it here. So why? I guess it's just a good idea to have an idea of when you need to, go and see a doctor if you're having some symptoms after caving. Obviously, a lot of what I'm going to talk about today is pretty rare and unlikely, and common things are common, rare things are rare. So I don't want you guys going to the doctor and just saying you have leptospirosis or something. Just, maybe mention that you're cavers and they'll be aware of some of the common signs and symptoms. So I am going to ask a couple questions, and, actually, give me one sec. Okay, so first with fungal infections, this is actually a picture of me after 2 weeks up at Scapegoat. Yeah, we'll just jump right into a question and see where you guys are at. So, a 30-year-old male comes into the ER complaining of a wet cough and trouble breathing and body aches. He is an avid caver in the Mississippi River Valley and recently returned from a 2-week caving trip. His past medical history is significant for HIV, and labs show a CD4 T cell count of 140, which is really low. Histopathologic examination of a mediastinal lymph node shows the following. So, anybody have any ideas? I can give you multiple choice too. Yeah, good job. Didn't even need the options. Which one do you want? This is the last green one. Yep. Oh, histoplasmosis. Yep, I'm going to talk about it a little bit. Histoplasma capsulatum. So, histoplasma, it's a fungus. It's really common in the Mississippi River and Ohio River valleys, kind of in the southeast portion of the United States, but it is all over the world, and it's a very, very common fungal infection. Most of the time, it's going to be asymptomatic. If you do have symptoms, they're most likely going to be pulmonary. You're going to have some pneumonia-like symptoms, fever, cough, chest pain, that kind of thing. So it's going to proliferate best in bird and bat droppings. It likes dark, damp soil, and it kind of likes the nitrogen content that it can find in those droppings. So when you're caving, obviously sometimes you're going to be crawling, deep in the dirt and mud with your face down, and you could potentially breathe in these spores and get infected. It's most likely to resolve within a week, but symptoms can progress to respiratory failure. There's a lot of literature with HIV co-infection with this. If you're immunocompromised, it's much more likely to be severe. But it's pretty easily treated. That's the good news. We got some good drugs for it. As far as prevention, if you know you're in a cave that has a lot of this infection in there, it's probably best to wear N95, and if you're immunocompromised, it might be best not to even visit these caves. Okay. Oh yeah, this is just an X-ray of someone who is infected with histoplasma. You can kind of see, I got a pointer, don't I? Kind of see a inflamed lymph node here, and then some infiltrate, just some inflammation up here. This is just pretty common symptoms or findings for pneumonia, not specific to histoplasma at all, but this is kind of what you'll see. Okay, next question. What is one of the most dangerous viruses that we know of once symptomatic infection has begun? And it essentially has a 100% mortality rate. What do we got? Yellow shirt in the back. Sorry, Hans. Rabies, yep, correct. You guys are good. So rabies is correct. All right, so rabies is zoonotic borne, highest fatality rate, like I was saying. Worldwide, there's about 59,000 deaths per year. That's mostly in third world countries where there's just health disparities and they don't know how to recognize it or treat it. I guess it has no treatment, but just because they don't have good facilities, there's no good supportive therapy. Only about 2 to 4 in the US happen every year. And worldwide, the biggest issue is dogs, getting bites from dogs. But these are some common vectors here. In the United States, it's actually bats that produce the most. So this is my dog. She doesn't have rabies that I know of. That's how she asked me to go play with her outside. She's very cute. Her name is Huckleberry. And this is one that is interesting. So Marburg virus, it's kind of similar to Ebola in its presentation. It's pretty severe. First outbreak that was recorded was actually in Europe, but they think it kind of came from Africa, and Europe was just a secondary outbreak, I guess. So symptoms. You're going to have fevers, chills, headaches, and malaise, usually after a 1-week incubation period. Fluid loss is your main issue. You can have a lot of vomiting and diarrhea, and that's just going to deplete you of fluids. And it's spread by contact with infected fluids, fecal-orally, not an airborne virus at all. And you can prevent it by using good hygiene and just supporting better public health infrastructure in endemic areas, especially Africa. Pretty much all of the outbreaks since that outbreak seen in 1960 have been in Africa. It's seen in other places as people travel, but they traced them all back. So I'm just going to go through a couple of the cases that were related back to caves. There have been a lot more outbreaks than the ones I'm going to list here. Not every single one has been traceable to a cave. But in 1998, you had a couple of men working in an abandoned mine in Democratic Republic of the Congo, and they all got the disease after being heavily exposed to bad excretions. Genetic analysis of the virus in the patients at that time showed different strains, which I think is kind of interesting. In 2009 in Uganda, there were 2 women who entered the same cave at different times. One was diagnosed after returning home and having rapidly progressive illness that led to death, and the other was undiagnosed, but she had, pretty similar symptoms to what you'd see in Marburg. You had some blood clots, some liver inflammation, and after she had recovered, her serum screening showed Marburg antibodies. In 2017 in Uganda, there was an outbreak attributed to exposure to bats during rock salt mining. 4 members of the same family were infected, 3 passed away, unfortunately. In last month, actually, 2 simultaneous outbreaks in Tanzania and Equatorial Guinea were reported. There's no known link between the 2 yet, but laboratory tests so far have confirmed 22 cases, and there have been 15 deaths so far. That was just last month, so this is still going on. So in 2009, the CDC isolated Marburg and Egyptian fruit bats. I'm not even sure how to say this. You guys probably know better than I do. Rosetus gypticus, maybe? That's not to say that all of these infections are coming from bats. They've never traced the infection back to a bat necessarily, but just with all of these symptoms being traced back to caves mostly, it probably is born from a cave at the very least. So now we're going to talk about a few bacterium. So real quick, leptospirosis is a bacteria found in mammal urine, especially rodents. It's spread via contact, fecal orally, contact with a wound when you're in water, which is pretty common for cavers to, be exposed to that kind of environment. Chlamydia psittaci, different than the chlamydia that everybody thinks of, but that's bacteria found in bird droppings, and it can be spread by inhalation. Unlike your fungal infections, it can stick around even when those droppings have completely dried out. And then with Borrelia species, you get a lot of these tick-borne relapsing fevers, a bunch of different kinds of those. Lyme's disease is sort of the infamous one around here. Cave fever in Israel was traced back to a tick-borne illness, and tick-borne relapsing fever as well. Prevention of that, obviously DEET. There's a lot of at-home remedies that suggest, you remove the tick with your fingers, or you use gasoline, or you use fire. If that sounds dumb to any of you, it's because it is. Don't do that. Get some tweezers, get down as far as you can on the tick, grabbing the head, and slowly remove it, and then clean the wound afterwards. That's what you want to do. Okay, and this is just erythema migrans. It's kind of commonly seen after a tick bite if you're going to get one of these diseases. This bullseye targetoid-like rash is what people think of most when you get a tick bite and you're possibly going to get Lyme disease, but they can appear like these as well. Okay, another question. 65-year-old retired man comes to the office for a health maintenance examination. He has no history of major medical illness and takes no medications. He lives in a single-family home with his cat and his dog. He spends much of his time in his basement woodworking. He does not smoke. His temperature is 37 or 98.6 Fahrenheit. Pulse is 84, respiration's 12, and blood pressure is 138 over 88. Physical examinations show no cyanosis. The lungs are clear. Cardiac examination shows no abnormalities. Extremity examination shows no edema. The patient wishes to mitigate his risk for pulmonary disease. This patient is at increased risk for lung cancer because of which of the following environmental exposures? It's a good thought, but not the answer I'm looking for. I can give you guys options. So this isn't necessarily infectious. Oh, who said it? It's radon. Good job. One of these is for you. All right, so radon is a big problem in our area, especially in the Midwest. You can kind of see the map here. Red being high potential for elevated levels of radon gas. Yeah, that's actually what I'm talking about. It. We'll get there. Okay. So I was curious about this because, like he was saying, it's showing up in some of our caves here. And at least with horse thief and Denise's crawl, the recommendations are you wear your N95 as you're crawling through. And I just didn't understand that. And like, if it's radiation, how is a mask going to stop it? But basically, radon is a gaseous decay product of uranium-238 and radium-226. It can damage your respiratory epithelium. It's implicated in cancer in non-smokers, although the jury is still kind of out what extent of a role it plays. There's well-established literature on increase in lung cancer risk for uranium miners due to radiation risk from radon. It can and does accumulate in the basement of homes. So in horse thief, Denise's crawl, you're going to want to wear your N95 masks when you're doing that crawl. Everybody's going to be kicking up dust. As radon decays, it forms other radioactive elements that are solid called radon daughters. And these can collect on dust and move through the air. If inhaled, these dust particles can settle in the lungs and just cause repeated radioactive damage to your epithelial cells. So you're going to want to, if you're in this area and you have the means to, it's a good idea to test your basement. If you discover radon, keep your basement well ventilated and avoid spending long periods of time down there. Wear N95s in the crawl, and maybe continue to do so throughout the cave if you're surveying and kicking up a lot of dust or anything like that. I don't know, Will, have we tested recently to see if it's still a problem in horse thief? Where's Will? Will's not here. That'd be a good question for Will, though. I might ask him that later. All right, and I think we've got one more question, and then we're going to be done here, or time for questions. Okay, from the list below, a pair of brothers, 35 and 38 years old, present with fairly dramatic pneumonias. On lung exam, rales are easily heard. Chest x-rays of both men reveal bilateral and diffuse infiltrates. The brothers spent a day together 2 weeks ago hiking in a mountainous area of Virginia where they entered a dusty cave. The most likely causative agent is in the back. What'd you say? Okay. You can take a guess. It's going to be G, histoplasma again. Any questions? I don't know. I mean, that they are the same kind. I'm not sure. Are there two different types of histoplasma? Yeah. Any other questions? All right, thanks.